Hello, friends, and welcome to episode 1197 of the Juicebox Podcast. Today we'll be calling my anonymous guest Dani. This is a cold wind episode, of course. Dani is an Army Forces reservist, a pediatric E.R. nurse, the mother of 2 children, and one of them has type 1 diabetes. Today we're going to hear about what she sees at her job. Nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan. Don't forget to save 40% off of your entire order at CozyEarth.com. All you have to do is use the offer code JUICEBOX at checkout. That's JUICEBOX at checkout to save 40% at CozyEarth.com. Do you have type 1 diabetes, or are you the caregiver of someone with type 1? Are you also a U.S. resident? If you are, I need your help, and so does everyone else. Go to t1dexchange.org/juicebox and complete the survey. That's all I need you to do. Your answers to simple questions that you will know the answer to are going to help to push type 1 diabetes research forward. It takes about 10 minutes. t1dexchange.org/juicebox. Support yourself, support the podcast, support other people with type 1. Today's episode of the Juicebox Podcast is sponsored by the Contour NextGen blood glucose meter. This is the meter that my daughter has on her person right now. It is incredibly accurate and waiting for you at contournext.com/juicebox. This episode of the Juicebox Podcast is sponsored by the Eversense CGM. An implantable 6-month sensor is what you get with Eversense, but you get so much more. Exceptional and consistent accuracy over 6 months, and distinct on-body vibe alerts when you're high or low. On-body vibe alerts? You don't even know what that means, do you? EversenseCGM.com/juicebox. Go find out. This show is sponsored today by the glucagon that my daughter carries, Gvoke HypoPen. Find out more at gvokeglucagon.com/juicebox. All right, Dani, let's get some background from you. Let's start personal first. What's your connection to diabetes?
My daughter, who is 4, is a type 1.
Okay.
I have 2 children, but...
She's the type 1. And
yes.
How old was she when she was diagnosed?
She was 2.5.
Oh, a year and a half ago-ish?
Yeah, a little over a year and a half ago. So,
is she your oldest or your youngest?
She's my oldest.
Okay.
I was pregnant with my other child when she was diagnosed.
Perfect. I mean, honestly, right? You're trying to make a baby. And then this happens.
Yeah. I had definitely some moments where I was like, I definitely asked my OB, I was like, what kind of testing can we do on this fetus? Because like, I'm really stressed out. It was, you know, you just go in that spiral mode at the very beginning when you're like just overwhelmed with all of the information. So
yeah. It feels like it's a joke a little bit too. You're like, I have this little baby and I'm making another baby and this is what's going to happen right now. Yeah. Anyway.
Yeah.
How about professionally? What do you do professionally?
I'm a pediatric emergency room nurse.
How long have you been doing that for?
This role in particular, I've been doing for 5 years. I've been a nurse for about 12 years.
Okay. That's a long time.
It's a minute.
How do you get that education, like the undergrad? I hear people talking about it all the time, that some nurses go to like private schools and cost a lot of money and they feel like the education is not much different than if they had gone to community college. Is that about?
Totally.
Yeah.
I think that there's definitely different ways that you can do it. Like there's a lot of different routes and a lot of different ways to skin a cat. And, you know, at the end of the day, an RN degree is an RN degree. Mm-hmm. It does affect like your ability to sometimes get hired at like magnet facilities if you don't have a bachelor's degree. I graduated during the recession, so it was really hard to get a job at a baseline. So it was like a bachelor's degree was a must-have. Yeah, you can get an associate's degree and still take the NCLEX, which is the same test that you're going to take if you have a bachelor's degree.
Okay.
And doing a bridge program to get your associates to your bachelor's is really not that complicated. I have my master's degree as well, but...
Okay, let me take you back for a second to... You finished your NCLEX, right? You took them, they went well, you passed. What was your feeling about your readiness at that point? Like, if I could go back and talk to that naive person, was she like, I am Dani with an I, and I could probably do anything? Or where were you then?
I think that's an excellent question. I was thinking about this yesterday when I was walking into work, just like, who was I as a nurse when I was a new grad and walking into work, so naive to just like people and how human beings are and like how that has changed like my perspective so much, like, you know, over time as I've become a parent, as I've had a child with a chronic illness, how that perspective has changed. But I think like when I, you know, was a new grad nurse, I went to a really great school. I mean, nurses listening to this will think this is strange. I took 7 semesters of clinical. Normally it's only 4 semesters of clinical. So I was adequately prepared from my like college that I attended, but I think you're naive and you don't know what you don't know. And it is on the job training. And there is so much that you learn, like when you are taking care of real human beings and you're not just like having these hypothetical situations where you're like, this is what's going to happen when you have this patient scenario present. So yeah, I think just like the naivety, I was 22 years old. Like
Right.
Also I was immature. So like, let's be honest about how much that changes things too. So
What do you think you learned about people? Like, what were your first, like, oh my gosh, I didn't realize this about the world stuff?
yeah, I actually lived with my best friend the first year. And I remember we had our hallway full of sticky notes of like one positive of the day, because I honestly wanted to quit nursing after the first year. I worked on a cardiac step-down floor. So I was taking care of adults. You know, I think you come out of, or I came out of nursing school with the perspective of like, I'm going to make people better and I'm going to help people and be a really great person to people. And like, people don't care about themselves sometimes. Like, I'm taking care of these adults that like don't take their medications. They're there for a congestive heart failure like episode where they're swollen all over because they haven't taken their medicine, or, you know, they didn't go to dialysis. And so now they're in an arrhythmia that we need to resolve, or, you know, they've like, you'll get a patient that just had open heart surgery and then their family's bringing them Burger King. And you're like, well, you didn't get this way from
In the hospital?
Yes.
Have it your way.
Yeah, absolutely. You know, so you're just like, I think that the humanness part of it is like something that I just was unaware of. And it would just be really frustrating. Like, I'm trying to help you and you don't care. Like, the patient doesn't care.
If you take insulin or sulfonylureas, you are at risk for your blood sugar going too low. You need a safety net when it matters most. Be ready with Gvoke HypoPen. My daughter carries Gvoke HypoPen everywhere she goes because it's a ready-to-use rescue pen for treating very low blood sugar in people with diabetes ages 2 and above that I trust. Low blood sugar emergencies can happen unexpectedly, and they demand quick action. Luckily, Gvoke HypoPen can be administered in 2 simple steps, even by yourself in certain situations. Show those around you where you store Gvoke HypoPen and how to use it. They need to know how to use Gvoke HypoPen before an emergency situation happens. Learn more about why Gvoke HypoPen is in Arden's Diabetes Toolkit at gvokeglucagon.com/juicebox. Gvoke shouldn't be used if you have a tumor in the gland on the top of your kidneys called a pheochromocytoma, or if you have a tumor in your pancreas called an insulinoma. Visit gvokeglucagon.com/risk for safety information. Dani, let me ask you a question.
Yeah.
You're completely covered. We're going to change your voice. We're calling you by your porn name. Like everything's good, right? So
Yeah.
do they not care? Do they not understand? Have they given up? Is there a mixture of reasons? Is it an intellect issue?
I think it's probably all of the above. I worked in a very urban area when I was a new grad. Like, I worked in the same city that I can like say like a general area of that, but I don't work in that area anymore. A very, very large city in the United States. And like, you have a conglomerate of people. So there is going to be an educational discrepancy between different people of like what they know, resources available to them, like level of care. Sure. But like definitely level of understanding of the impact of what they're doing, how that's going to affect their health in the long term.
Like, do you think, taking the Burger King example, do you think they don't know that's not good for them? Do you think they don't know that's what got them into that position? Or do you think they know and they don't care? It's all they can afford? Like,
I mean, like, if you look at it from like a general demographic standpoint, like, I think that there's absolutely all of those variables in play. Like, some people do like want to do better for themselves, but they can't afford it. Like fast food is cheap. And so like, you're still going to get a really good, like, not a really good, like a
value for your dollar as far as like quantity and quality, not quality.
Like buying organic lettuce is more expensive. Like buying a salad is more expensive than buying a Burger King hamburger.
Yeah. Yeah, I got you. Okay. So like, but to you, the person who's got to get up, drag their ass there, do this thing, poopy, pee-pee, a lot of unpleasant things happen in there, death, people are generally at their worst, for not even their fault. Like when you get thrown into that over and over again, you said you felt like you wanted to quit early on. Do you think that it's easy to blame them when it's the situation? Or do you think it's them?
I think that there's definitely both, but like having worked with adults and children, I think that in large part, I think that at some point in your life, you have a choice to make and you're an adult and you can make your own adult choices. Mm-hmm. I think my perspective changed a lot when I worked with children, like parents want the best for their children. And they want them to be well, and they will do that at whatever cost in general, not always, but in general, they will do it at whatever cost. And I think adults, like, sometimes they know and they're just like, this makes me feel good right now. And so I'm going to do that because that's what's best for me right now. Like, sure. Whether that's like a financial issue, an emotional issue, a literacy level, like problem, like a resource level problem. It's hard to say exactly what the specific issue is, but I think like it is variable depending on the patient. But I think people in general like have a choice to make. And at some point you're an adult and you get to make choices. And there are consequences to your choices.
Yeah, no, I want to tell you, I agree with you. Yeah. And I've also been in the middle of a situation where I'm watching myself make the wrong choice.
Right.
And while I'm doing it, I think this is not the right thing to do.
Right.
And you just don't stop. That part is difficult to understand, I guess, for me personally. But you said parents want the best for their kids. What about parents who clearly don't want the best for themselves? Do they still want the best for their kids?
I would say on a whole, yes. Uh-huh. Even the really, really, really terrible things that I see, there is some level, like, unfortunately, I see really, really sad things. Like I see people abusing their children, and there is some level of remorse, even if they're the abuser. Like you can see it. Like,
are you there?
Yeah, I'm here.
Oh, I'm sorry. You paused. It was such a pause. And I thought, my God, it's so quiet. I think she's gone. I was in the middle of a thought and you paused, which screwed us up. I was in a home store recently, and this guy was being really shitty to his like 11-year-old daughter. And I was in an aisle looking at something, and I was trying to concentrate on something. I didn't know exactly what I was doing. So I was learning while I was standing there. They were 40 feet away, and just over and over again, he was just like reductive to her and kind of treated her like she was stupid. Like, you know what I mean? Like, and then it stopped, and you thought, okay, maybe there's a bad moment. And then they open their mouth again, and it's happening again. And there's this feeling inside of you, like, I can't do anything about this, right? Like, what am I going to do? Go tell him, like, be nice to your kid?
There are definitely parents that come in, and I see the way that they interact with their children, and it's unfortunate that they are inadequately prepared to be a parent. Parenting's hard. Don't get me wrong. I yell at my children sometimes. I don't want to do that either, but like...
Well, you have to. They're little motherfuckers.
Yeah.
No, I'm just kidding.
Sometimes last night, get in bed. It's time now. I've been awake all day.
So I had that moment where I thought, like, is this a great guy? Do these two have a fantastic relationship and there's just something happening right now? And I thought, in the end, maybe, but there are also people who that's how they are to each other constantly.
Totally. I don't think it sets kids up for success in some ways, but like, I hear what you're saying, like, absolutely. But at the end of the day, you brought your child to get care in some capacity, whether you are present in this care, because I had a kid dropped off literally yesterday, a young teenager, like early teenager, dropped off by her parent, and her mom said, let me know when you're done. I'll see if I can leave work to pick her up. Okay, kind of a problem.
Can you tell me vaguely what was wrong with the kid?
I don't remember what she came in for. I feel like it was like abdominal pain or something, but like, that's really sad. Like, we did lab work and you're just going to let her do this by herself?
Yeah. Interesting. Like a teen, like 13, like that kind of age?
Yeah, I think she was like 13, 14. Yeah.
just sit in the ER and give me a call when you're done. And if I can get out of work, I'll come get you.
I'll see
if
I can get out.
Wow, that's interesting, isn't it?
Yeah.
I don't know how to ask this question. Oh boy, I don't know how to ask this question. Was the mom a big mess? Like, what was the problem?
No, I think from a resource standpoint, and I don't understand everything. I got social work involved, and it's probably I need to work because I need to make sure that I can pay for my child, right? I'm trying to look at it from a different perspective too. Yeah, I think it's really crummy. I would never do that to my child. However, I don't know what your financial work situation is. Maybe you just started a new job and you're on your 90-day trial and you need to show up because you need to make money to pay your mortgage. Maybe you're a single mom. I don't know all these other variables that are going into it. So I try to be gracious in that piece, but I'm also well, I wouldn't do that to my kid, but this is what we're dealing with. So,
right. Well, yeah, I mean, I guess that's really the issue is that you're, first of all, you're experiencing it over and over again. Talk to that piece first. Talk about what happens when you're surrounded by repetition all the time. Do you start believing the world's that way, or do you just believe that it works that way? This episode of the Juicebox Podcast is sponsored by the Eversense CGM. EversenseCGM.com/juicebox. The Eversense CGM is the only long-term CGM with 6 months of real-time glucose readings, giving you more convenience, confidence, and flexibility. And you didn't hear me wrong. I didn't say 14 days. I said 6 months. So if you're tired of changing your CGM sensor every week, you're tired of it falling off or the adhesive not lasting as long as it should or the sensor failing before the time is up, if you're tired of all that, you really owe it to yourself to try the Eversense CGM. EversenseCGM.com/juicebox. I'm here to tell you that if the hassle of changing your sensors multiple times a month is just more than you want to deal with, if you're tired of things falling off and not sticking or sticking too much or having to carry around a whole bunch of extra supplies in case something does fall off, then taking a few minutes to check out EversenseCGM.com/juicebox might be the right thing for you. When you use my link, you're supporting the production of the podcast and helping to keep it free and plentiful. EversenseCGM.com/juicebox. ContourNext.com/juicebox. That's the link you'll use to find out more about the Contour NextGen blood glucose meter. When you get there, there's a little bit at the top. You can click right on blood glucose monitoring. I'll do it with you. Go to meters, click on any of the meters. I'll click on the NextGen, and you're going to get more information. It's easy to use and highly accurate. SmartLight provides a simple understanding of your blood glucose levels. And of course, with second chance sampling technology, you can save money with fewer wasted test strips. As if all of that wasn't enough, the Contour NextGen also has a compatible app for an easy way to share and see your blood glucose results. ContourNext.com/juicebox. And if you scroll down at that link, you're going to see things like a buy now button. You could register your meter after you purchase it. Or what is this? Download a coupon. Oh, receive a free Contour NextGen blood glucose meter. Do tell. ContourNext.com/juicebox. Head over there now. Get the same accurate and reliable meter that we use.
I actually think the last year has really changed and shifted my perspective from people. I don't know the whole story. I don't know the whole picture. I try to see the other side and view it from a different lens, take a step back. What are the resources available to this person or this nurse or this family that maybe are lacking or are abundant and maybe affect the way that they perceive this situation?
Mm-hmm. So this last year has changed your perspective a little bit. Are you talking about since your daughter has type 1?
Absolutely. So I had just had a really crummy year right around the same time that my daughter got diagnosed. My dad was in the ICU for 2 weeks with a subdural bleed and had, brain surgery. This was 2 weeks after my daughter was diagnosed. And I had my younger child, that was not a planned pregnancy. I had gotten back from a deployment. That's the short version of the story. I had just gotten back from a deployment. And so it was just an unplanned pregnancy and not unwanted, but Yeah, it sounds really terrible. If you got the whole story, it would be even better. And then you can really go with the stripper name even better there. So
just roll in the door. You're like, me so horny.
Yeah.
Like, yeah, okay. All right. I got you.
Oh, it's even better than that. So yeah, I'll just tell you the whole bit. I went on a deployment. My father-in-law ended up getting really very ill. So I went on emergency leave from my deployment, came home because my husband was trying to take care of his father, end of life choices, things like that.
Yeah.
And just was overwhelmed with taking care of our child. She was not diagnosed at this point in time. This is like right before she got diagnosed, but it's overwhelming. Like he doesn't have the extra resources and help. So came home. I was home for literally a week.
Was this comfort or excitement
week.
Sex? What were you doing? Were you trying to make him feel better?
Yeah, it's grief. It's grief. Grief is a real thing. Yeah.
I think we all understand. Went
back to my deployed location in the Middle East. Buying a pregnancy test is really fun and pleasant. So it was a really great lifetime.
Oh my God. I want to remind you, stay close to that microphone. I like you so much better when you're close to it like that. Okay. Wow. I didn't realize you were in the military. Are you in the reserves?
Yes, I'm a reservist.
Okay. So you got back and you say to somebody, hey, I can't stay long.
Yeah, it was definitely one of those moments. I mean, I knew that there was going to be consequences to my choices. I had sex with my husband, which is not unallowed, but those are things that there was consequences to my actions. So I dealt with those, and it was just like, hard on that piece of my career time for the military. It's not unwanted, but it was unplanned pregnancy. So I'm like overwhelmed, like with hormones. And then my child has this chronic illness diagnosed. My dad's in the ICU. Like it was just overwhelming.
His father's passing. And
yeah.
Is it a, I don't know what the word is I'm looking for. Like, are you not allowed to get pregnant? Like, cause you're in the reserves? Like, what is that?
You are allowed to do those things. You would think based on some of the ways that people respond to those things that you are not allowed to do those things.
And that you maybe did it on purpose to get out of your deployment.
Right. And I definitely did not.
You're like, he was crying. What did you want me to do?
Yeah.
Yeah. No, I hear you.
Yeah. The way that is handled in the military is just really sad. And I get it. Like, I'm not saying that people don't do that on purpose, but I didn't. And I was disappointed in myself, like from a career perspective, and it was frustrating and it was embarrassing in a certain way. And
did it hurt you? Like career-wise, did it hurt you?
Oh, absolutely. Absolutely.
Would you just get put like on a mental, like, oh, she's one of them lists?
Yeah. Some of the things that were said, like behind my back that came to me at some point were entirely inappropriate. And there was, I was eligible for upgrade in my role responsibilities, and someone was giving me feedback, and basically I repeated to them, and I'm like, so basically what I'm hearing you say is that I'm being punished once again for having children. This was pretty recently.
Interesting.
In the last 6 months. Yeah. So I was like, okay, like that's fine. I will pick my children every time now. So yeah.
Interesting.
Those experiences definitely just, made me feel like you don't always know the whole picture of what's going on with someone. So
Right. So that's the idea, is that now people come into that ER and it's easy just to think like, oh, you shouldn't just drop your kid here. So I do this thing, Dani. It's this idea that I took out of a commencement speech. So this is convoluted, but this writer gave a commencement speech. It's got to be 20 years old at this point. It's called This Is Water. You can actually buy it as a little book now, or you could listen to it on YouTube or whatever. One of the things I took from the man's speech was that I don't know why people are doing what they're doing. And there are, reasonably speaking, people doing those things for poor reasons that they could have avoided. And there are people doing those things for reasons that were unavoidable. And so the example I normally use is if somebody's driving horribly and cuts you off in traffic and it's all very dangerous, I can choose to believe that person's an asshole. Or I can choose to believe they're about to shit themselves and they're trying to get to a bathroom. Right?
Yeah, absolutely.
And I don't know which is which, but it only hurts me to choose that they're an asshole. Like that.
Absolutely. That's
what it taught me, is that if I decide everybody's a dick, then that's an anger that lives in me. They don't know I feel that way. And
right.
And it's of no value for me to walk through the world believing that everybody's terrible. Because the truth is that some people are terrible and some people aren't. And some people just need to get to the bathroom. And so like when I don't know the truth, why would I choose to believe everybody's terrible? Anyway.
I agree. You said it's called This Is Water.
Yes.
I'm going to have to check that out.
You can listen to it on, I mean, somehow back then there was a video camera there. You can actually listen to him give the speech. The little book, when people graduate, I give them a copy of the book. It's not really a book. It's it's the speech pressed down.
Right.
Just because it's just such a clarifying thought for me that I don't know your situation and you might be an asshole. Like I might be 1,000,000% right? You might just be driving badly. But
you might have Crohn's disease and be needing to go to the bathroom really fast.
All I'm getting at. Like somebody's just trying to get to the Starbucks and get through the lobby without looking too conspicuous. You know what I mean?
Yeah.
And what does it help me? It only helps me to believe that they're just a person in a bad situation.
Absolutely.
Right.
And I think that like that piece of clarity and like level of compassion and empathy is something that takes time to learn. And I don't think that when you're, a new grad nurse, when you're 22, that you have the life experiences to like back that.
Yeah, no.
And some people do, but I didn't. So
let me say this. This all makes me sound very ultra liberal and soft. I want to be completely clear. I do think some people are just fucking horrible.
Oh, I don't disagree with that either. There are some people that I'm like, okay, well, you're kind of a piece of shit.
Again, how is it for me to decide who's who? So instead, I just keep a balance in my head that I know that, there's a spectrum of the way people act and there are a spectrum of different implications that are happening in their lives that are changing their behavior. I know I'm a decent person. And I also know that you could easily find me and isolate 2 minutes of me and think that guy is terrible. And as a matter of fact, it happens to me sometimes. So like, because of what I do, if somebody is just to pick up the wrong episode of this podcast as the first one, I might come off very poorly to them.
Well, I mean, like, I still have this, deep feeling of deep-seated empathy and like wanting to grow and be a better human being at this point. But like, there are days that I am a royal bitch.
No, please. Yeah.
I am not always the kindest human being in the world either. Like, and I realize like that I have flaws and I'm not perfect either. So yeah, like.
Let me give you a great example from right kind of around now. It's been a few weeks, but someone tried the podcast and started off on an After Dark episode about sex workers. And that episode, it's called After Dark Sex Worker. And it's called Sex Worker because that's what the person called themselves. Colloquially, she's a stripper. And if I was going to name the episode, I actually would have called it After Dark, like stripper. But she called herself a sex worker. So I did her the respect of making that in the title.
Right.
Now, this long conversation with her, I mean, I can't remember it. If I'm being 100% honest with you, I couldn't, like, if you took me to court right now, what I could remember about it was she was a newer diagnosed type 1. She was stripping she said that her diet consisted of Jack Daniels and cocaine. Like when I tried to ask her about her, like she was talking about her blood sugar at one point. I tried to ask her about her diet and she's like, it's mostly Jack and Coke. And I realized what she was saying. She told me a story in there about her father dying of an overdose like recently. And I remember her making a joke about how great her tits were. These are the things that stuck out in my head. I asked her, do you feel bad getting those guys in the back room, getting them worked up and taking their money off of them? And she said, no, because I've got great tits. And I was like, oh, fair enough. And like, so like, and we moved on. This is literally my remembrance of this conversation. It went on for an hour and I don't remember the rest of it.
Yeah.
A week or so ago, someone left a review to let everybody know how icky I am and how terribly I treated her and all that other stuff. Now, you know what that person doesn't know? That 6 months ago, that girl sent me an email, said she's clean now and is giving me the credit for it.
Bravo to her.
Right? Fantastic for her. And she listened back to that episode and heard herself for the first time and made some changes to her life. Now, the person who read the review, what does she really know? I assume it was a woman. And so, I mean, I don't know. All right, that was sexist, but I assume the review's from a woman. Now, here's the funny thing. Dani, someone's going to hear me say that and leave a review 6 months from now that says I'm a misogynist. That's what I mean about not being, no, not possibly, Dani. I've been doing this for a long time. I know exactly how this is going to go.
Yeah.
But like, that's what I mean about not knowing other people. Because do you know me as a misogynist?
No, I don't see you as that, but
right.
I don't know you on a day-to-day basis either. So,
well, all I do is I kick dogs and punch women. What does that make?
Yeah, I mean, 100%. I definitely wouldn't have imagined that. But, if that's what you do in your spare time, that's your choice. I view you differently, but see, obviously I don't know the whole picture.
See, Dani, and you can tell a joke and be funny and sarcastic, and someone will come along and miss that. They won't know that you were being sarcastic. The review will say, he said he kicks women and dogs, and that woman laughed.
Right.
Like, my point is that we can't know each other, right? Like really know each other and what's in our hearts and what's happening. Now, having said all that, let's talk about what it's like to work in an ER, and especially a pediatric ER. And I want to know all of the things that have struck you that you've reevaluated since your daughters had type 1 diabetes.
That's a lot of things to think about and say, but I think there are times in your life, like becoming a parent. I started there right around the same time I got pregnant with her. I had worked at the same facility in like several years prior for like 9 months or so. Mm-hmm. So I'd worked for that company before, but being a parent changes the way that you treat other children, because you have a level of empathy and compassion that you didn't have when you weren't a parent. And not to say that I wasn't a good nurse and wasn't compassionate and empathetic before that, but I think it gives you a perspective that you truly can't understand until you become a parent. And then more so, like when you become a parent with a child with a chronic illness, you become empathetic in a way that only people with a child with a chronic illness can understand.
Mm-hmm. I mean, do you have something that you look back on and think, oh, I shouldn't have done that way, or we shouldn't be doing this like this? Because nursing is a younger person's game, right?
I mean, bedside nursing tends to be a younger person's game. Absolutely.
Okay. So go ahead, please.
Yeah, there's absolutely been moments. I'm trying to think of something more specific, but there have been moments where I'm like, man, I didn't say that the right way, or I could have handled that situation differently, or I should have said something else to the patient because maybe they perceived what I said wrong. And I am the first to go in and say, hey, I'm really sorry. I think maybe we misunderstood each other. It is hard. Like, I don't do it right every day either.
Yeah. And that's not for a lack of trying or concern or desire, right?
Right. But there are people that I work with that maybe don't have the same tact or compassion or empathy to be like just aware of those little isms that people are giving off and vibes that people are giving off. So, yeah.
So you see it now, like another nurse will do something and you'll think, oh, I would have done that 5 years ago. And
oh, absolutely.
Right. Now, do you say something? Like, is there a mentoring situation, or is that not the vibe?
Oh, 100%. I am like real big. Like, that is one of my current passions. And like, feedback is hard to give, feedback is hard to receive, but like, that's the only way that anyone is going to be better. Like, and there is a time and a place to do it. So I'm not going to do it in front of a family member. If you're making, unless it's a glaring safety mistake, I'm not going to like correct it in front of a family member, because I don't want them to lose trust in the person that's taking care of them if I'm just in there helping you hold for a procedure or whatever.
Right.
But I will pull you aside afterwards and say, hey, my feedback for you next time, like, would be to do it this way. Yesterday, I had a new grad. I was in charge yesterday, and she kept sending me messages, and there was one message that she sent me that was kind of urgent. And so I didn't see it right away because I was doing something else. And I was like, if you ever have something urgent, just give me a call next time. Like, I want to help you and I want to help you do it right. Just give me a call. Like, because I don't always see the messages in the chat.
Is that helped? Is that received well normally? The constructive criticism? I
have learned that it's not always received well, but I think that it's the presentation, and like, feedback is hard. Again, it's hard to receive at any point in time, but like recognizing like, oh, you're really busy right now, this is definitely not the time to give it to you, or hey, I have something that I want to talk to you about, let me know a good time for you, so that they're in the right headspace so that they receive it better.
Have you seen nurses in a position of power give good feedback the wrong way?
Oh, absolutely.
And then
Absolutely.
is that just a stone wall then? Like it's not received well and it all is just for nothing?
Absolutely.
Yeah. And why do you think that happens? Why do you think that people are like shitty in that situation?
Some people have an ego that is larger than it should be, an inflated ego. Like we have, you know what, like there are some people that are really great nurses, or they're really, really intelligent, and maybe they're not as socially aware. Is that the right way to say that? Like, you know, they can be incredibly book smart, but maybe they're not as good at communicating things with like family members. And then there's some people that are vice versa. They're really, really good at having rapport with the families and communicating with patients. But maybe you're like, wow, like you got to think through this like prioritization right now. Like socializing with the family and developing a rapport is not as important as getting this antibiotic to a septic kid right now. So
that seemed like a very specific example, but okay. Just sitting around chatting while the kid's just drifting off into hell, and they're like holding the syringe in your hand, like that kind of thing. Yeah.
There are definitely sometimes where I'm like, I love that you are so good at communicating with people and developing a rapport. Right now, that's not the time.
Yeah, that's not the thing.
Yeah.
How well, I mean, it's a pediatric ER. How prepared is that ER or others that you have worked in for a DKA, a child in DK, for example?
I think it depends on the nurse that you're going to get for the day, which is really sad. I think that there are people that are more well equipped to handle that type of patient, and there are people that are not as equipped to handle that type of a patient. I think on a whole, my colleagues are going to provide care that is reasonable, but like the detail oriented and like attention to detail and the things that are required and the why they're required is lacking in some of them. I definitely think that there are many people, like I think on a whole, my colleagues are adequately equipped to do it, but maybe the details are a little muddy.
I'll have to be honest with you. The use of the word adequately is not filling me with hope. It just doesn't make me go, okay, great. As long as everyone's adequately prepared. Jeez.
Yeah. I think people forget to look at the resources, and like there are some people that I have seen like rely on their memory of what the, you know, policy or says. And it's like, I look it up every time. I'm like, I feel like I'm pretty good at this like now, but like, I'm going to look it up every time because number one, it changes. Number two, I don't know everything. Like, and I don't want to miss something because this can be a really critical patient.
Tell us why the why is important. Like, how come not just following the rules is important, or step by step? Like, why is the why am I doing this? Why is that so important?
I think the why in what you are doing helps you understand the details. So, you know, the way that our policy is written, like you're supposed to do a full neuro exam every hour on a patient that is in DKA. And I think that I just know like that some people don't do that every hour. And I think if you don't understand why you need to do that, like that this patient's at high risk for cerebral edema, then maybe if you knew why, then you would do it because you're like, oh, that makes sense as to why I need to do it.
We're looking for brain swelling because if it tips the wrong way, it could go quickly.
Right. If you are dropping their blood sugar way too fast, or they're so acidotic, like they have a high risk for those changes, like osmotic pressure changes to occur, that would be bad for your patient and could potentially be fatal. I mean, fatal's strong, but like, you know, can cause them brain damage. So
how many kids that go into DKA end up with brain damage?
I feel like I looked this up very recently. I don't think it's a really very high number. Like it's probably less than 5%, but there are certain like populations that are at a higher risk for cerebral edema, you know, like if they're under a certain age, if they're blood gas, so something that you check to see if they're in DKA, if their blood gas is more severe, then that can really increase their risk for cerebral edema. Yeah.
Okay. But if it's 5%, then you're saying 5 out of every 100 kids could end up with like irreversible damage?
Brain cells don't grow back. So, but the degree to which your brain cells, like, also you're going to have, you know, potential damage if you're like hypoxic or something. But Yeah, brain cells don't go back, but like irreversible damage, like to what degree? Like, I think 5% is like probably generous, but don't quote me on the exact number because I don't know. Yeah. I don't know off the top of my head. I think that's what I read.
Have you seen it happen in your 12 years?
Oh, yeah. I had a kid probably like 6 months ago that I was taking care of who was definitely altered and needed mannitol. So, and 3%. Because they were having cerebral edema. So,
wow.
Because they were they already came to us in a really bad place.
Sure.
So it wasn't us, like it was the situation. And we just, yeah.
Gotcha. No, I understand. I just trying to give some context for people. So,
right. I would say the majority like that. I think that is the only one that there's another one that I think I took care of a long time ago that needed that in the PICU, but I would say the majority are well. And I don't have the statistics or data to support that, but like we send a lot of patients home from the ER that are new onset and we don't even admit them to the floor. They go and they follow up outpatient that are new diagnosis.
Why would they not be admitted?
Depending on your level of like, if you're not truly in DKA, like if you come in, my child was not admitted. We went home and we followed up with outpatient the next day, even though she was 2 years old, which that was more because I asked them to do that and I didn't want to stay there.
Looking back, should you have done that?
No, I actually think it was fine. We caught it really early. And so she wasn't truly a DKA. I mean, her blood sugar was 701. Like the blood sugar is you can be a DKA as you know, like, and your blood sugar can be 120. Like,
right.
Yeah. So yeah, I think we do send people home that are new diagnosis. I would say the large majority don't even go to the PICU. We send a lot of kids just to med surg. So.
Is there any other autoimmune in your family or any other type 1?
There's no type 1 that we know of. Autoimmune, I think that is like, I've never been I've never been formally diagnosed as celiac, but I've been gluten-free for like 15 years. My dad has been told that he probably shouldn't have it like more formally. He does take like a liver enzyme called Creon. It's like a pancreatic enzyme that helps him digest food a lot better.
Mm-hmm.
No, she just drew the short straw.
Gotcha. Okay. What made you want to come on the podcast? Like what did you hear that you thought like I can add to this?
I think like the big thing that I'm like super passionate about is like we can do better. Like there's always room for medical professionals to do better and be better. And like it is the small things that matter. And it's also the big things that matter. Like there are small ways that you can interact with people and there are big ways that have bigger impact. Just knowing that like if you're a healthcare provider listening, like you can do something small. Like for example, my facility, for whatever reason, I don't know why they had this, but before my child was diagnosed, like we were using adult lancets to do finger pricks, and like those hurt like motherfucker. Like we do. And so like, and they don't use those in an outpatient facility, like literally not very far from the building. And so like we advocated to get those parts numbers and stock those in our floor. And so that's what we use now, because you can get an adequate sample of blood to test glucose with a smaller lancet. So why would we not do that and like cause less harm to the patient? It's a small thing,
but it's easily adjusted.
I think it has a big impact.
Yeah. It's easily adjusted and it does have a big impact because if you're being tested that first time, and it hurts that badly, it will flavor what your expectations are moving forward, probably your anxiety level and a number of other things.
Yeah.
Have you made other adjustments at work based on your new knowledge?
Oh, absolutely. I will be the first person to say, before I had a child that was diagnosed with type 1, I was scared to take a patient with DKA. I was probably adequately prepared to do a standard. I could follow what the policy said in black and white, but I didn't really understand the why behind everything in the level of capacity that I should, because like you need to know enough about a lot of things. You can't know everything about everything. Like you can't. Sure. You just can't. You don't have a bandwidth for that. And so it's not something that I was like deeply passionate about. But I think that's because like I remember in nursing school that diabetes was something that I had a hard time understanding, and I just didn't like totally grasp it. And so it was something I avoided because it wasn't easy for me.
Do you recall how so? Like why? What about it was difficult to understand?
When I was in nursing school, like you have to like know the peaks and the troughs of like all of the different kinds of insulins, and like I think it was just overwhelming to me. And I don't know why, but for whatever reason, it was just not a type of pathophysiology that clicked well for me in my brain. Mm-hmm. And I tend to be a learner that if I don't get something right away, like I am a relatively intelligent human being, but if I don't get something right away, I get frustrated, and so I avoid it, which is not the best way to handle things. But like, I knew enough to get by and pass my test and do things in an adequate way. I wasn't good at it, and so I just avoided it because there was things that I was more passionate about, like
Right.
that I was good at.
What do you think the difference between what the average person believes a nurse understands and knows and the reality of what they understand and know? Like, what do you think that gap looks like?
I think that that's a hard question to answer because I think that there are varying degrees of prepared nurses. Like, there are people that can skate by nursing school and not actually know the information, and there are people that like really spend a lot of time and really study and maybe can't articulate it very well, but you know that they know the information deeply.
Mm-hmm.
So I think that that's a hard question to answer entirely because I think that it is varying on the level of what people know and what their experience has taught them.
Maybe the question should be, how should we be defining what a nurse is and what they know? Like, do you know what I mean? Like, because I'm trying to put myself in the perspective of an outsider looking in. And, to me, I mean, I used to say this a lot on the podcast, but I think there are some things we don't question. Doctors, you go with what a doctor says. Anybody connected to the medical field, you go with what they say. I know people who are receptionists in doctors' offices and act like they're smarter than they are.
Mm-hmm.
Because, I work in a doctor's office, and people go, oh, you do? Wow, a doctor's office. That kind of thing. We do that for teachers a lot of times. Sometimes we do that for police officers. We do it for people in positions of authority normally, right? Like,
absolutely.
So like, I'm sick. First of all, I'm sick. I'm not coming to the hospital for fun.
Mm-hmm.
So I'm run down. I'm not thinking straight. I'm scared. I'm worried about money. I'm worried about my job, all the things. I'm worried about my kid. I got all those things going on. I get there. I get to the magic place where the wizards live and the people who help the wizards. And then I get there to learn that you're not a wizard. You're 22. You just wanted a job, and you avoided diabetes at school because it was confusing. Now,
and I mean, like, I'm the first person to say that, and now I live and breathe it every single day. So I couldn't avoid it anymore.
So like, what would it help? What would people need to know that you think would help them balance their expectations and get them a better outcome in a hospital setting? That's the question. What should my approach be?
I think just knowing, like, there is like standards of a curriculum that are required from an educational board review to like allow you to take the NCLEX. The NCLEX is going to have like, there's a new NCLEX now, so I don't know exactly how many questions. It might be the same, so don't quote me because I didn't have to take this one. But it used to be anywhere from 75 to like 200 questions about a wide range of things. It's going to be covering like babies all the way to like geriatric patients. And it's going to cover everything from the brain to musculoskeletal situations. Like and pregnant people, like, you're going to have so many random things in there. And if you're only going to have 75 questions that you're tested on to get a license, like I took I do remember I passed in 75 questions, but like, people can know just like, you need to know just enough about a wide variety of things. And then it's up to the nurse, like, to understand, like, later on, like, as you grow and in your profession, like, you are able to get certifications, but like, that is self accountability of like wanting to grow professionally and like be a certified nurse in whatever area that you're in and continue your education and development so that you can be the best that you can. But like, really, people have this general knowledge, and like, people, even if you're in a specific area, you're going to have passions and things that you're good at and things that you're bad at. And so maybe this is not their strong thing. And especially in the ER, people know like a lot of things, but they don't know, like, not everyone, but most of them know a general amount about a lot of different things.
Just not a lot of specificity.
Right. But if you go to the endocrinologist, like if I go to the clinic, they're going to know a lot about diabetes, or I would hope they do.
Well, okay. So I was going to say, does this extend to the doctors in the ER? Like, are there doctors in that ER that you look at and think, if I fall over, please don't take me over there?
Yes. Yeah. Like, I know that there, like, my pediatricians that I work with, even the like ones that are fellowship trained in pediatric emergency medicine, I swear, if there is someone that comes in that is pregnant because they just see the sign that, says that there are children that come here, they lose their minds. Like, they don't like OB patients. Like, that is not for them. But they're really good. A lot of them are really good at taking care of kids. Like, but they're going to consult like a cardiologist. If a kid comes in with a heart issue, they're going to consult endocrinology when we have a DKA kid every time, because they want the expert in that specific area to make sure that they're giving them the resources so that they can give this patient the best care that they can receive.
Okay. But there are doctors you wouldn't want your kid to go to.
Yeah, there's ones that I would rather see than not. Like, I happy with who took care of my child when we were there for DKA. So
does the doctor know that about themselves?
I don't know. Like, and I will say, like, I ended up with 2 providers taking care of my child. Like, one of them, I'm really glad that was the provider that took care of my child. He is incredible and so thorough and so compassionate, but he is slow. And so, like, when we are really busy, it's really frustrating. Like, to be a nursing staff, he's going to take really great care of his patients and do a really, really good job. But we are not going to be, there's going to be a waiting room and it's going to keep growing, which decreases patient satisfaction. So then you're maybe not going to listen. Like, there's the flip coin of that too.
Yeah. How about just knowledge? Like, are there, like, not just slow or fast?
Yeah.
Do they know they're not good at it?
Yeah.
I don't know how I can force you to assess that, but do you think they know, or do you think they're pretending and they're like, I don't know what I'm doing, but I got to look like I know what I'm doing? Or do you think that they think they're out there slaying it and everyone else is looking and going, my God, like, we got to, like, don't send this one over there or he'll kill her. I'm trying to understand if people understand who they are or not.
Yeah. I think that it is varied. And I think that some people are introspective enough to say, this is not something that I love and it's not something I'm passionate about. And so, like, because that, I just know that I'm not as equipped to care for this patient as maybe Dr. Smith next to me, who really loves this type of patient. Like, I have a colleague who's like one of our providers whose child was diagnosed shortly after. And like, she loves taking those kids now because it means something to her. Like,
yeah,
she feels like she's making an impact. I think it's because of her child, like, that she feels more passionate about it now than she did before that happened. So
you're a very nice person. You won't, like, put yourself in other people's, like, minds and tell me what they think, which they call generalizing, in case you're wondering.
Yeah. I know I'm really good at generalizing. I have opinions, but
you're being fair. You're younger than me too, right? Like, by a lot.
But I also, like, can be introspective enough to know that I, again, don't know everything about everyone. And, like, my opinions are my own and they may or may not be right, but they're the lens that I view the situation in.
Yeah, absolutely. But I was saying about the age thing because, like, I just think I'm from I don't really care
what people
to be nice to people if I don't want to be. Like, so
yeah,
when I'm being nice, I'm doing it on purpose. And when we're having conversations like this, I don't see the value in being nice. Like, we're trying to get to the bottom of something. Do you know what I mean? Like, so
I mean, I see what you're saying for sure.
But a couple generations behind me, you guys are just nicer.
Yeah, I will say, like, there is a level of holding back because of professionalism, and, like, I know how to I try to present myself well. But, like, I will tell you, like, when I say that my coworkers are adequately prepared, I know that they can step up and do the job if we really need them to. But I have a lot of coworkers that are incredibly lazy, and I might not tell them to their face that they're incredibly lazy, like, out of being nice, but they're just lazy. And so they'll just delay things, which affects patient outcomes because they're being lazy.
So sometimes when I'm in that ER room and things are taking too long, on to hours, and I'm like, there's no reason for this to take that long. I'm right. They're just out there sitting there staring, looking at their email. Is that right?
Sometimes. I will say that that's not always true because, like, you have to wait for the provider to put the orders in. And if the provider then gets, like, sidetracked and does something else, like I literally cannot, like, the way that things generate, like, I can't pull a medication out of the Pyxis if it's not available because you didn't put the order in.
Sure.
Ultrasound, maybe they have 2 other patients that need to be seen. So, like, it's not always, but, like, there are definitely some times where I'm like, there are some of my colleagues, so I'm not speaking about myself, but there are some of my colleagues where I'm like, what the hell are you doing? Get up. Like, this patient, like, yesterday I grabbed somebody else, like, I had a colleague that was encumbered with something far more critical, and there was a DKA patient there, but we had a patient that was trying to die. Like this patient, with the other patient was not actually in DKA, but was like soft DKA.
Yes,
like,
and slipping.
Yeah, like needs insulin, but like, you know, it can wait. But like, let's get it going, because like there's 2 other people that are available to get this signed off and get it started, while the nurse that was assigned to that patient was legitimately encumbered. So there was a delay in care because they were, you know, saving someone's that was dying. So
yeah. But do some people just slip through the cracks? Like, are there doctors and nurses that are just like, you know, crackheads? And you just like, do you look at them and think like, how did you even like pass the test? How did you get here?
100%. I'm like, what is, like, are there lights in your head? Like, wake up.
Okay.
Like, yeah, absolutely.
All right. And we have some people who are very knowledgeable who have bad bedside, but you're going to get good care. There's people vice versa. There's like, right. So there's all different kinds of people. Does it balance itself out, or does it lean to the wrong side?
I hope that it balances itself out. I hope that it does. I genuinely think people that work in pediatrics have like a different perspective than people that work with adults. And maybe that's like a little bit harsh, but I think you have to have some level of patience that you don't have to have with adults. And like, I think your level of patience with adults is like, my level of expectations when I'm taking care of adults is that you're going to curse me out and you're going to like be mean and rude and disrespectful, even though I'm literally here trying to help you. And like, kids are just better. Like, kids are so much easier, even if they have parents in there. Like, kids, if they are upset and crying, like, they have a legitimate reason to be doing so the majority of the time. Mm-hmm. I think that lends itself to like being able to be a little bit more empathetic and compassionate as a provider, like, and someone caring for that kind of patient.
I see.
I've been cursed out one time in the 5 years that I've worked there, and I got cursed out almost every single time that I worked before with adults. So
with adults, every day somebody lets you have it
in one way or another. And yeah, absolutely.
Mean or just cursy?
Both. Like, sometimes mean, sometimes short, sometimes like legitimately wanting to get something like that I just don't have the resources or bandwidth to support.
Right. Can it get personal? Do they like your looks or something like that come into play or anything ever?
Oh, totally.
Oh, okay. Jesus. Yeah. My God. All right. So, sorry.
Totally.
So basically,
it can.
God, can you imagine? You're working as hard as you can, and on top of all that, somebody's like talking about your thighs or something at the same time, and you're what?
Yeah. I like will never forget this one patient whose name I cannot use, but like when I was a new grad, like working on this cardiac step down floor, she was just mean to everyone, like so mean. But like, I was definitely the youngest person on my floor, and she would just like let me have it for being so young. Like, you snarky little brat, like you think that you know everything at 20 years old, like get out of here. She would come out with her walker and just like hand up, yelling at me.
And that's part of the job, right?
Yeah. Okay, got it. Thanks. Understand. I mean, she was mad because you're not pushing her morphine fast, so that, you know.
Yeah.
Okay, you're mad at me. But that's just, it is what it is right now, ma'am.
I had somebody else tell me something recently from a pediatric ER perspective that threw me off so much. I'm going to ask you the same question. Mm-hmm. You see kids come in ODing on things that their families leave around the house?
Mm-hmm. Every day.
That's a thing that happens constantly, right?
Every day. Every single day. You know, I guess I don't have TikTok, so I can't speak to this, but there's a TikTok challenge. Don't take too much Benadryl. That can kill you. Also, it makes you hallucinate and be crazy. Like, I feel like Benadryl right now is like the thing. Tylenol, like, I'm not exaggerating. Yesterday, like, we had 3 overdoses yesterday. Intentional. And like abusing drugs, like, you know, we'll get kids that come in that smoke so much or do marijuana in whatever way that they do it. Usually smoking, but I know people take edibles and whatever. But,
Dani, I'm just thrilled that you said do marijuana. Go ahead. That was fantastic.
Do marijuana, whatever way you do it. I don't know. I'm naive.
I'm going to guess
I learn a lot from these teenage kids, like things that they tell me. I'm like, I am learning a lot about drugs right now that I didn't know.
I'm going to guess you don't do marijuana by the way you said that.
I like being reservist. I have never done it in my life. Yes. No, I've never done it. So
such a funny way of saying it.
Yeah.
Like, so edibles like little kids get a hold of edibles laying around the house?
Oh, yeah. We'll get like 2 or 3 year olds in there that like, you know, have some brownies and
they're high as a kite. Those little kids are high as a kite, right?
Well, they're just like pass out like for hours. Like, yeah. Yeah.
What happens there? Do you report the family there to social services, or how do you handle that?
Yeah, it actually depends on like, yes, you do make a report. Social work handles it, but like what degree DHS follows up is really variable. You know, if somebody is positive for marijuana and they're breastfeeding their child, there's actually like higher levels of THC in breast milk because it binds to the fat. Like that is how THC is like done. So like there are higher levels in breast milk.
That's a better way to do edibles.
Yeah. In breast milk. There you go. Have some for someone that smokes marijuana. So or eats edibles.
You're fantastic. Okay. So, you know, I mean, listen, when Cole was like, I don't know, a year and a half, 2 years old, it was Halloween and we were carving pumpkins and I left a knife on the floor and he kicked it. So he got a cut in between the webbing of his toes. We'd take him to the ER. It's terrible. Yeah. Social services was called on us for that.
Yeah.
And I was like, oh, okay. Like, it was a scary moment. I remember, like, wait a minute. Like, are you going to take my kid because I was carving a pumpkin with him? Like, that's weird. Mm-hmm. I think it's a great thing.
I mean, we screen every child that is under or 2 and under for child abuse. So there's like a 410 spaces is what it's called. And it, you know, helps us identify potentially kids that are slipping through the cracks. And, you know, that's a really good advocacy piece of things. But
do you pick kids up weekly, daily?
I don't know what the data is supporting from that, so I couldn't speak to that like on a...
But you've had it happen to you? You've screened somebody and thought this kid's being abused?
Actually, my child, this is really embarrassing, like right when we rolled this out, one of my coworkers, the short version of the story is my child had a bruise on her face. She was just starting to like walk at that point in time. And so like, you know, like when they're just walking and getting bruises on their face, but it flagged us positive for that particular screening because she had gone in for croup. Yeah, and I screened positive for my own child right when we went live with that. So,
and even though you worked there, they reported it.
It's literally on her chart. I can see it on there still. It's embarrassing. We have kids that come in there and like if it's explained and like I'm not hiding it, like this is what happened, and you know she's just walking and starting to like she hit her head on a table. Like like I was supervising her, but she is a klutz right now because she's just
toddling. That's where the word comes from. By the way, yeah.
And so like it's an explainable like situation. It just happened to like she hit her face just on the wrong spot. That's going to flag that screening. And
and so now, but the good thing is it's written down in case it happens again and again and again. Then we can see the pattern. I got
patterns. Yeah.
Okay. All right. Oh God. Do you wish you weren't a nurse? Do you wish you would have picked something else?
No, I think that I like what I do now. I've gotten to do a lot of different kinds of nursing, and I've done some other nursing that I've really enjoyed, and I really can't imagine doing anything else. And I am really, really grateful for the opportunities that it's afforded me and people that I've met and things I know. Like it makes me a better human to learn how to communicate more effectively. Like I don't think I would be good at business because I think it's taught me how to be empathetic in a way that you can't be empathetic otherwise. And yeah, I'm glad I'm a nurse.
I'll tell you a secret. It's not really a secret if I'm telling you. My wife just started a new job.
Okay.
And for her entire career, my wife's an old person. She's 50. And so for her entire...
so old. She's not that old.
Oh my God. I don't know. She looks
Don't tell her that.
I'm just teasing her. She's younger than I am. She started a new job. And for her entire career, she's put a premium on being kind to the people that work for her and to help them progress and to learn and to grow and to move up. And over and over and over again throughout her career, it has been held against her. And you know, by people above her, when they're looking at my wife for advancement, it will be listed as a detriment, not a positive. That Kelly cares about the people who work for her. Like I've seen it numbers of times, right?
Right.
But she just started a new job yesterday. And it's a great position. It's one of those like career cumulative things. Like this is exactly what she wanted to be doing. On her first day, the person that hired her said, we knew immediately you were the right person for the job. And keeping in mind, 75 people applied for this job.
Wow. Bravo, Kelly.
Oh, very cool. I'm super excited for her. But one of the things the woman said was, we're very focused on our employees being treated well.
Mm-hmm.
And it was clear that you knew the technical aspect of this job and had the lifelong experience. And on top of that, were willing to put in the extra effort to be a good people manager.
Mm-hmm.
And so my wife finally got paid back for what she's been doing for like 3 decades now as a professional person.
Yeah.
But for the first 3 decades, it hurt her pretty consistently.
Yeah, I think I can relate to that. Like in the military, I've always been kind of a sensitive soul, and has not always served me well in the military because I have moments where I cry more than most. And like as an ER nurse, that's not something, those people tend to be a little bit more harsh, I guess is the right word. Like just direct maybe is a better way to describe it. And so, I mean, it's those two things have really encouraged me to be more direct, but I don't think that I still lack the empathy, which is valuable. And I think like you have good managers and bad managers. And I think the way that you say things matters to people and it does impact them. So people
I agree. I'm going to finish with this. First of all, I'll ask you, is there anything we didn't talk about that you wanted to? And then I'm going to ask you one last question.
I don't think so. I mean, I'm sorry we didn't talk a ton about diabetes, and it was more about...
No, you're misunderstanding. This is all about diabetes. If this goes the way I expect, people are learning how to navigate the medical system by listening to this conversation, which will help them immensely with their diabetes. Like, listen, like just because today we talked about Dani and her working in an ER, this is no different whether you're in an ER, going in a doctor's office, or, you know, in an urgent care or anything like that, to 100%. Remember that you're just dealing with people.
Right.
That's it. They're not magic people. They're not wizards. They're just people who are like, you know, I think I'm going to be a nurse, or I'm going to try to be a doctor. Mm-hmm. Just the same way you said, like, I think I'm going to be an actuary.
Yeah.
You're not perfect. You're not a perfect although actuaries are a bad example. Those people might be perfect. That's a mental illness in and of itself, but good for them. Very, very, very specific work. But you know what I mean? Like most of us go into things because like, you know, this seems interesting, but 15 years later, you might be like, I don't even like this, or I'm not very good at this, but I'm stuck. I got a mortgage. So I go in every day. It's not to say that people are bad at their job or that you're going to get bad health care, because you're going to get plenty of great health care, but you don't know who's who. So you can't just run in and go, I'm here, take care of me. And if it's all going backwards, go, well, I must be dying because everyone here is on the exact same level and has the exact same amount of enthusiasm for this, because that's not the case. And I just think people need to be reminded of that sometimes. It's not. I think if I could say one thing to people, like as patients coming in, like, you know, and advocating for your child, like, sorry, I'm not going to speak to the adults because I work with kids right now, advocating for your child. Like, one, you don't see the whole big picture of what's going on in the emergency room. And like, yes, that can be incredibly frustrating. And maybe you do have a lazy nurse. And for you, I'm very sorry that you got stuck with the shit assignment. Like you got stuck with the cheating nurse today. Mm-hmm. But I think taking a deep breath and saying, even if you say it to the nurse, like, I don't care when people say this to me anymore. I think I probably cared when I was 22. Hey, I know that you're here and you're taking care of my kid. I just want what's best for them. And I'm not trying to be like giving you a hard time, but like, how can I make this better? Or what can I do to like contribute to this situation? Or like, how can I help us bridge the gap of like what I need? So like, I really want this to happen right now. And like, if you just, I think sometimes people get rightfully so deeply concerned about their child, and I want them to be deeply concerned about their child because that's who they're there for. Right. And I have other patients I'm managing, but like your child is the most important. Just remind me of that, and it helps me take this time out to be like, oh yeah, like helps slow you down. This person
matters right now. I think it helps people slow down too. Like, I'm here and I care about my child, and I just want what's best for them. I'm not trying to take it out on you. Like, sorry if I'm getting a little snarky or snippy, but I want what's best for my child.
Remind the doctor or the nurse of the humanity of the whole thing.
Yeah. Like, you're doing the best that you can. I don't know the whole picture, but I care about my child the most right now, and you should.
Yeah, that's great. That's great advice. In your note to me, you said that the lessons you've learned from the podcast, not from your 10 years of nursing, have been valuable helping your daughter.
Yeah.
And so this is question asked partly so that, you can say something nice about me, but also because I want to understand what it is that a 10 plus year nurse didn't know about type 1 diabetes.
I mean, I said it previously, I was scared, and it was just because of a lack of knowledge and lack of desire to learn from a personal standpoint, because it was something that I didn't understand.
Mm-hmm.
And so it has not only helped me like with the tools of like the things they don't teach you necessarily right off the bat of like pre-bolusing and thinking about fat and protein, and, like your range doesn't, like they were telling me to treat a low at 90 at the beginning. I'm like, I'm treating a low at 90? You are insane.
I just got it to 90.
Like, knowing that I can change my target range and it doesn't have to be the same, and like that my child, I care the most about my child when I go to an endocrinology appointment, and they're doing what's best for the masses. And not everyone has the same knowledge and literacy and medical understanding and background that I do, and like knows how to advocate and do those things in the same capacity. So like they are teaching at a level that is generalized because they have to, because that is the way that they can reach the majority of people.
When I say that on the podcast, I wonder, I hope it comes across the way I mean it. Like, it's not an indictment. Like, it's just, it's what it is.
Right.
You're going to get.
I don't think they're doing it in a malicious way either.
Right.
Like, they're doing it because, I mean, I see people on a day in and day out basis. Like, the people that listen to this podcast, like, good on you for wanting what is best for your child. But I'm going to tell you, like, some people just don't have like the bandwidth, space, knowledge bank, like resource level, like
the gear
to know that there's more out there to make it better and make it right.
Yeah, to even imagine that there's more than what's being said.
Yeah.
Yeah, and I take that for granted because that's a basic personality trait of mine.
I'm with you. I want to I want to do the best that I can.
I assume that I am always doing something wrong.
Right.
And I don't mean that in a way of like judging myself. I mean that I assume that there's more information that I don't have. And I mean about everything. When I'm buying something, when I'm taking care of a pet, when I'm, trying to consider my children's health, when I'm trying to consider my own health, like I never think, ooh, we got it. I always think, all right, well, there's more, but I bet you there's more past that. And what is that? And how do I find out what that is?
Yeah.
That's a mainstay of how my brain works.
Yeah.
Can I ask a disconnected question?
Yeah, absolutely.
Earlier in the episode, you said the company I work for. Mm-hmm. And I think people don't think of hospitals as companies, but very much so, right?
I'm not going to speak to like my specific role, but at the end of the day, a hospital is a business and they are there to make money, and there are bottom lines. I know that I still have a lot to learn about that piece of it because it's not something that I've been a bedside nurse for the majority of my time, but it's a business at the end of the day, and they're there to make money, and there's a bottom line. So
yeah,
it's a company and an organization, and they might be not for profit, but they're there for a profit. Right. They have to pay people, and they have to pay an overhead fee, and they have to keep the lights on. So
you also want to be careful moving forward about some of these organizations that have so much capital that they're basically a hedge fund operating as a something else. Mm-hmm. Do you know what I mean? You see colleges like that now where their goal seems to be more about investing the money that they have than teaching kids. And that can happen in any industry. Once capital gets so big, they can start seeing themselves literally as an investment firm that happens to also own hospitals.
Right.
Anyway, so the reason I
don't get me wrong, I think my organization really does care about children and wants what's best for them and the outcomes that are best from them. But at the end of the day, there's the bottom line. Also, I'm not flattening out the organization, talking about it like as a general. The people on the ground are normally always I think about that even like when people complain about like pharma companies and stuff like that. They're like, them. Like, most of the people that work there are people, and they're trying really hard to do a good job, Right. The majority of the employees there are that.
Right. And then somebody at the top is counting the beans and being like, make the toilet paper thinner. Like, like that kind of thing is happening.
Absolutely.
Right. But do you think, like, based on that idea that they are money-making ventures, have you seen enough of AI-based stuff to think that it's going to make its way into hospitals? Because right now I'm involved with a company called Vision AI. It's a startup.
Okay.
But I'm seeing what they're putting together, and I was almost cursed for no reason, but it's fucking fascinating. Like a person I know was having a problem the other day, right?
Mm-hmm.
And this problem, they called me, they described it to me, and I said, I think you need to go to the ER. But first, and I opened up this Vision AI portal that I have because I'm able to using it now before it's widespread with everybody. And I put in not even like a coherent sentence. I said to the person, send me all your symptoms. And she sent them to me, not even coherently. Like there weren't even like periods or commas. And I copied it, pasted it into the AI. The AI came back with 5 possibilities of what could be going on. They were all rock solid. And the top 3 guesses, I was like, it's going to be one of these things. It's either going to be a drug interaction or it's going to be a mass. And like, seriously, like that clearly.
Mm-hmm.
And I said, go ahead off to the hospital. Went off to the hospital, did a brain scan, came back, did a little more testing, said, hey, you're having a drug interaction. And that was it. And I was like, oh my God, the machine knew. Like at what point do we stop worrying about how long the doctor takes to get back with its orders? Like at what point are we going to start asking machines and then having doctors be overseers of the information that comes back?
I think that you're spot on. I think that technology is always advancing, and we would be amiss not to use that type of technology and integrate it. And it's only going to propel things forward in a really hopefully positive. Like you got to have guardrails on it to make it safe, of course. Yeah, we would be amiss not to. Like, I know that efficiency has increased as a result of technology, but even in the diabetes realm, I was talking to one of my other providers the other day, like the way that AI has extracted information and helped us create data from that's meaningful is only going to allow us to like not have to spend the time as human beings doing that.
Mm-hmm.
Now it's generated, and so then that will propel us forward to the next step of whatever AI can contribute. So
yeah, I have this theory that people are going to become technicians in healthcare and no longer the repository of information, because that's really, a doctor is a person who's taken years and years and years to learn a lot of things and interactions, and this plus this plus this could mean this, this, and this, and here's how we'll figure out which one of those it is, right? That's all it is. It's a process of elimination.
Yes.
I'm pretty right about that, right?
I will tell you that I see my providers, even the ones that I think are brilliant minds, looking things up on UpToDate. And yeah.
Right. Being a doctor is process of elimination. It's starting off with some knowledge, honing in, and then eliminating till you get the answer.
Differential diagnosis till you get the answer.
And so we're counting on reasonably intelligent people, which, by the way, I've seen a study recently that says that the most intelligent people are not the people who become doctors. They're still very intelligent, but they're not at the top of the. Anyway, that's not important. Yeah. So we're asking for intelligent, well-educated people to make these decisions and whittle us down. And you can see that it works great in some situations. You break your arm, you go in. There's a flow chart. Yes, the arm's broken. This is the kind of break. Here's how we're going to fix it. Boom. 6 months later, your arm feels better. Hey, ta-da, that works great, right? We're really good at stuff like that. Hey, my hands are always cold. My hair's falling out. We're not as good at stuff like that. Like, and you might have to go to a doctor for years and years and years, 15 minutes here, 20 minutes there, before suddenly there's this epiphany between you and the doctor and the notes and everything where somebody goes, oh my God, you've got whatever. Right. Yeah. Right. And now I think it's going to be possible for your literally like a portal, a web portal. You're going to be able to go to the hospital and say, hey, my AI doc says this is what's wrong with me. And then go through that process, and their AI doc's going to look at it and go, yeah, it agrees. And then you're going to have a technician, who we used to call a doctor, go over it and go, I concur, and move forward. And you're going to get through that process so much more quickly.
Interesting.
To an answer. Yeah, that's how I feel like it's going to go.
Interesting. I think that you still have to have the human aspect, because you still sometimes need, like you talk about like thyroid or like, a glucose level, like you're still going to need the human being to say, it could be that we need to do X, Y, Z to figure out that you have diabetes or your arm is broken or.
Yeah, no, I agree. I mean, I think I genuinely believe that obviously a person's going to be necessary. I mean, for the foreseeable future that I can understand, right? But
absolutely.
But I don't.
My generation too. I don't think I'll be alive to see it without it.
Right. But I don't know that we're going to need them to do all the work.
I agree. And I think we would be amiss. I mean, you think about it from like a telehealth perspective too. Like people can call a doctor on the phone.
Yeah.
And like, videotape it. I will also say I've done telephone triage at one point in my career. It's really hard to do some of that stuff, but there are a lot of things that you can rule out very easy over the phone.
Oh my God. Yeah. I mean, the telehealth taught us a lot. Telehealth taught they're like, we don't really need to see you that much, I guess. I'm trying something right now to show you. And if it works out, I'll read it to you. And if not, I'm going to call this the end. But I just typed something into this Vision AI portal that I have that's actually connected to Arden's glucose information, her live glucose information. So you can ask this thing anything from what's my blood sugar to, I'm about to eat, like blah, blah, but I just asked it a pretty obtuse question and it's thinking and I'm wondering what's going to happen. So hold on a second. Let's figure out here. But I've already asked it things like, I'm going to eat 15 grams of carbs, or I'm going to eat 30 grams of carbs. I think 15 of them are going to be pretty fatty. How would you proceed? And it gives like pretty rock solid advice.
Interesting. Yeah.
And at the moment, the company is, I probably shouldn't say this out loud, but I've entered into an agreement with them, and they're taking the information from the podcast and adding it to what the algorithm, what the AI understands. It's pretty cool. Okay, so hold on a second.
Thank you for adding valuable information.
Oh yeah, wait till you see. Okay, so I haven't pre-read this. Arden just had a spike. Now, she clearly didn't pre-bolus a meal, but she didn't miss by much because it shot up and came right back down again.
Okay.
How could I have avoided the most recent glucose spike? To address most recent glucose spike you experienced, which peaked at 252 at 11:49 a.m. today, we can analyze the surrounding circumstances and data to provide some actionable steps. Analysis of the glucose spike. 1, timing and previous meals. The spike occurred late in the morning, which might suggest it was related to your breakfast or late morning snack. Reviewing what and when you ate during this time could provide insights. High carbohydrate meals or snacks without adequate pre-bolusing can lead to spikes. 2, insulin bolus and timing. At 11:44 a.m. and 11:40 a.m., you administered 0.9 units of insulin each time. That's the algorithm, by the way. Her algorithm was bolusing. It knows all this because it has access to her Night Scout. Before that, at 11:30 a.m., there was another 0.9 units that were given. Considering the timing of these boluses in relation to when you ate can be crucial. If the bolus was given too late relative to when you started eating, the insulin action might have been delayed relative to the peak glucose rise from your meal. Carbohydrate counting and insulin to carb ratio, ensuring that the carb content of your meals is accurately counted and that your insulin to carb ratio is accurately adjusted or correctly adjusted for the time of day will help in administering the right amount of insulin. Observations. The boluses given were relatively close in time, which might indicate either a response to food intake or an attempt to correct an already rising glucose level. The amount of insulin administered suggests either a smaller meal or a corrective dose. If it was meant to cover a meal, it might have been underestimated. Then it gives actionable steps, talks about pre-bolusing. You could aim to administer insulin 15 to 20 minutes before eating, blah, blah, blah. Review your carb rate count, continuous glucose monitoring adjustments, use your CGM trends to make real-time decisions, dietary adjustments, consult a diabetes care specialist. And it gives, by the way, every bullet point I just went gives a description about that underneath.
Interesting.
Yeah.
I will say, like, one thing I've noticed about AI is I feel like it's wordy.
Mm-hmm.
And I know you can change like the grade level, but I've noticed that it's relatively wordy. And I think for a vast majority of people, they kind of need more of like a 1-liner, 2-liner gut punch of like,
yep.
I think that much information can sometimes be hard to consume and digest for the majority of people.
Yeah.
That's my only comment on AI in its ability to.
No, I agree with you. Like, it's going to have to get more and more colloquial and
concise.
Yeah, right. And be
especially
able to
like with our generation of like that. And I'm saying my generation, like I'm 34, like I'm not like really old or anything, but I know people want it fast and want it now. So they want to have it their way. The Burger King.
I think it's coming because I mean, this is trained the way this company decided to, and by the way, this isn't just for diabetes. This is for everything. Like I said, a person I knew was having a cognitive issue, and it boom, it was like, it's either this or it's this. And it was just right. It was really incredible. It's fascinating. And these things didn't say anything I wouldn't have said if you would have asked me this question personally.
Yeah.
Yeah. So, and then on top of that, it's going to be trained on all of the management episodes of the podcast.
Yeah.
Yeah. So
I'm really excited to see how technology can be leveraged to make things better in the future. So
I'm telling you, I'm super excited by the whole thing. So, okay, I'm going to let you go. I've had you longer than I said I would. Dani, thank you so much for doing this with me.
Thanks so much, Scott.
Yep. A huge thank you to one of today's sponsors, Gvoke Glucagon. Find out more about Gvoke HypoPen at gvokeglucagon.com/juicebox. You spell that GVOKEGLUCAGON.com/juicebox. Arden started using a contour meter because of its accuracy, but she continues to use it because it's durable and trustworthy. If you have diabetes, you want the Contour NextGen blood glucose meter. There's already so many decisions. Let me take this one off your plate. ContourNext.com/juicebox. A huge thank you to Eversense CGM for sponsoring this episode of the podcast. Are you tired of having to change your sensor every 7 to 14 days? With the Eversense CGM, you just replace it once every 6 months via a simple in-office visit. Learn more and get started today at eversensecgm.com/juicebox. If you're looking for community around type 1 diabetes, check out the Juicebox Podcast private Facebook group, Juicebox Podcast, type 1 diabetes. But everybody is welcome. Type 1, type 2, gestational, loved ones, it doesn't matter to me. If you're impacted by diabetes and you're looking for support, comfort, or community, check out Juicebox Podcast, Type 1 Diabetes on Facebook. If you're not already subscribed or following in your favorite audio app, please take the time now to do that. It really helps the show. And get those automatic downloads set up so you never miss an episode. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. The episode you just heard was professionally edited by Wrong Way Recording. WrongWayRecording.com.